Hello, everybody. My name is Dr. Nova Ho. I'm one of the physiatrists in training committee representatives for the Quality Practice Policy and Research Committee. I'm currently a pediatric rehabilitation fellow at the Shirley Ryan Ability Lab or Northwestern University. I did my residency at Rutgers or Kessler Rehabilitation in New Jersey. I'm honored today to have Dr. Flanagan and talk to us a little bit and continue our Q&A series. So Dr. Flanagan is the president of AAPM&R and as well as the chair of rehabilitation medicine at New York University Grossman School of Medicine and medical director of the Rusk Rehabilitation at NYU Langone Health. And today we are going to be discussing data and quality, specifically why data is essential in today's ever-changing healthcare environment, and more about AAPM&R's registry and why participation is important, and more.
Delighted to be here and to talk with you, Nova. Thanks so much for doing the interview.
Thank you. I'm just going to jump right off to continue the Q&A videos. And our first question is focusing on the barriers and the barriers PM&R needs to address in order to advance our specialty toward the bold vision. Your recent editorial in The Physiatrist focuses on data quality and AAPM&R's registry. I would love to hear more from you on why data is essential in today's ever-changing healthcare environment.
Well, that's a great question. Hopefully, you have enough time for this interview to go through it all. But, I entered the world of physical medicine and rehabilitation as an attending in the early 1990s. And I remember that was probably a couple of decades after Howard Rusk had started, along with many of his colleagues around the country, sort of the whole field of physical medicine and rehab. And, when Dr. Rusk, who is now the founder of the place where I work at NYU, all he had to do to show the value of physical medicine and rehabilitation was to have a child with CP walk across a stage or a gym floor, or have a person with a spinal cord injury go to work, or show that someone with a spinal cord injury or a stroke or a brain injury could go back to living their lives. And he just had to show it. There wasn't any real data to it. And rehabilitation medicine really took off. But by the time I entered the field in the early 1990s, those golden days, they started to dim a little bit, in the sense that insurance companies, other key stakeholders wanted some more proof that what we had to offer was truly valuable. So they began to question what we were doing and really wanted scientific data. That's about the time where denial started to come into play with regards to inpatient rehab and what have you. And they wanted to have more data to say what you're doing over the long term is equally efficacious or more efficacious, and saves money at the same time. And we didn't have that. Now, I will say, over the course of time, there are many in our field who have really dedicated themselves to research. I'm in the world of brain injury rehab predominantly. So my colleagues like Flora Hammond, Ross Safan, Kathleen Bell, Amy Wagner, many, many others have really contributed to data supporting the work that we do. But there's still so much more that we need to do to show that what we do helps medicine, really helps to advance that triple aim of medicine, which is bettering population health, enhancing the patient experience, and making sure that we do it all more efficiently. And efficiently to the government is just a euphemism for less money. So we really need to start showing that value. And it's even more important now because we're moving away, the world of medicine, from fee for service to quality. And it's my belief that in order to reach that triple aim that I talked about, which really is quality, you can't really achieve it without physical medicine and rehabilitation being involved, or at least fully realize it. So we need that data much more than what we have. And we know that big data is really important in today's ever-changing healthcare environment. So we need that. Things like quality improvement initiatives are important, and I think we're all involved with that and the work that we do. But by systematically analyzing data, identifying areas for improvement, and implementing evidence-based practices, healthcare systems can achieve better patient outcomes, reduce medical errors, and enhance the overall care experience that patients get. There we go, the triple aim of medicine. And we know that research fuels innovation and drives advances in medical knowledge. It does that by uncovering new treatments, new diagnostic tools, preventative strategies, things that really can transform healthcare practices. But ultimately, it's that synergy between quality improvement and research that really fosters a culture of continuous learning, innovations, and excellence in healthcare. So we need the data, we need the researchers. We're not all researchers, but we all can contribute to that very end. So that's why data is so important. It's becoming even more important now that I've been in the field for 3 decades than it was when I first started.